All right, great. Welcome to the Teens Talk Mental Health panel, and thank you all for attending. We hope to have a great discussion about mental health and how COVID-19 has impacted teens over the past year. This event is being hosted by the DuPage County Prevention Leadership Team and Reality, the Teen Advisory Board of the DuPage County Health Department. Reality is comprised of high school-age teens throughout DuPage who advocate for prevention policies for healthy and safer communities. We will have some time at the end today to take questions from the audience. If you have a question, you can type it into the chat and we will address those at the end. On our panel today is Representative Tara Costa Howard, who represents Illinois District 48, as well as Dr. Jeffrey Money, school social worker at Glenbard North High School, Matt Quinn, Community Relations Coordinator with Rosecrans, Gavin Schilling, a senior at Glenbard West High School, and Jordan King, a junior at Naperville North High School. Thank you to all of our panelists for participating today. For our attendees today, if you have any questions, please enter them into the chat or request to be unmuted by the host to ask your question. We will have about 20 minutes after our panel discussion to take any questions that you may have for panel members. First, let's hear from the youth on our panel, Gavin and Jordan. We would like to hear from both of you for this opening question. What has the past year been like for you, and how has COVID-19 impacted the mental health of people your age? Gavin, let's start off with you.
Yeah, so for me, especially at the beginning, this past year, it was a lot easier to isolate, both with like activities that I was doing as things were being canceled, but also like isolate from, talking with people and connecting with friends. And I think sort of being isolated with my family. I know at least for a lot of like people I was talking to as school starting to go back in person, it's just harder to kind of express how you were feeling in these kind of turbulent times. It's harder for me personally and for a lot of my friends to talk with just their family. So, when we were all isolated, it was harder to express how you're feeling with friends or resources at school. And that just, kind of allowed, emotions like just feeling anxious or kind of lost about what's going on, as well as like expressing your disappointment, which is, a very real like reaction to what's happened in the past year. Just made it a lot harder to kind of like respond to those things, kind of address them appropriately. Also, yeah, it's been harder to reach out to people too during this time.
Jordan, would you also like to share your thoughts?
Yeah, definitely. This past year has been very interesting for me. I chose to look at it from more of a positive perspective, though. I see this past year, as more of a learning experience. And I think this year has taught me how to adapt really well to the unexpected. And I think I can speak for everyone on that. But it has also taught me a lot about patience, about empathy, and about how to be mindful as well. And I think it has taught me a lot about my creative juices too, because I had to find a lot of ways to entertain myself being at home all the time.
Thank you so much for sharing. Dr. Money, you work in the schools with teens firsthand. My first question is, what impact have you seen COVID-19 take on students?
Well, it's such a big question. And Gavin and Jordan, I think, articulated that well from two very different perspectives, how frustrating it is, and then also kind of how to look at it optimistically, which I think is spot on. It's something that we were kind of forced to do if we're going to survive. I can kind of speak to my own experiences, but my colleagues would suggest that a lot of districts and schools are very similar. So when COVID first hit, there was a shift in our efforts to assist students and families because our learning environments and the needs of the communities, they changed overnight. And this included the emotional and what we'll call the motivational needs of our students. Our students were essentially forced to suspend those things that give teenagers that sense of accomplishment and that promote that sense of agency that's so important for developing self-esteem. These things were all compromised in the snap of a finger due to COVID. Learning was different and strange from a distance, and teachers and students, really, I think I saw them just get unplugged like Gavin was talking about. There were no extracurriculars, no sports. They were put on hold. Seeing friends every day was limited or totally gone for some. All this stuff was just turned upside down. And so the fallout from the pandemic resulted in that abrupt, what I call a motivational shift with students and the adults. They had to place those self-esteem and those self-actualization needs. You know, if you're familiar with Maslow's triangle, that's where we strive to reach our potential. That was kind of stuck on hold, and we had to put that in the back seat and instead focus on that security and safety needs. This is where the school's efforts have been temporarily redirected so that we can help things seem as normal as possible given the circumstances, and to foster that very needed sense of safety and belonging in the school community best we can until the world gets back to a normal place again. But my personal observations too on how students have been impacted, I kind of see them in three phases. First, I think it took a while for this to sink in with a lot, because at our school, COVID landed around spring break, and I think the COVID close down felt like an extended spring break for a lot of students. And they struggled in coming back to kind of get that rhythm in learning, which lasted until the end of the year. But those who I did talk to, they shared how surprised they were that in-person learning was missed as much as it was. So then in the fall of this year is really when it started to like reach its full impact. And early on, which I guess I'd call it the second phase in the fall, I think kids with attention deficit disorder and autistic spectrum difficulties, I saw them struggle really the most, because they're extra sensitive to the changes in that steady structure and rhythm that school provides. I think it's been hard for them to sustain focus in the absence of that kind of structure too. Then about the second quarter, I began to get emails from teachers who I think really kind of saw anxiety and depression in some of our students. A great deal of them were really good academically, but they seemed to express like they struggled to cope, like Gavin was talking about. They were cooped up at home. I think they were mourning the loss of normalcy, not seeing friends regularly, getting into it with their parents. All of this was really taking a toll on them. Of course, being cooped up and cut off from our peer networks, that reduces that much needed connectivity for our teenagers. And that actually predisposes them to high levels of stress, anxiety, and of course leads to depression, because it's in a teenager's DNA to be with their friends a large part of the day. And that's one reason why I think that we see quite a spike in our mental health clinics in our communities, and indeed, you know, all over the nation and elsewhere. The third phase, just getting started. We're getting back to in-person learning, and we're seeing quite a bit of anxiety in kids. They're kind of dipping their toe in the water, but they're anxious, so they kind of retreat back to distance learning. And we have to kind of treat them almost like kind of anxious school avoidant kids to try to reacclimate them back to the school.
Thank you so much. And so our second question is, based on what you've seen, Dr. Money, what have schools been doing to support students this past year?
Yeah, really quite a bit. They've been really hopping. I've been really impressed with our administrators. They work hard on the measures to mitigate the spread of the virus. They have they're measuring spaces all the time to see how many students can fit in a room or an area of the building. They're developing protocols to move through the hallways. They're changing lunch tables for appropriate distance. All of this is in accordance with that ever-changing health guidelines and recommendations from our health departments. In social work terms, these mitigation efforts, they foster an increase sense of safety, which is really important given all of the uncertainty floating around. A part of what our social workers are doing, we're assisting teachers and staff to help students and families. We have a district team of social workers that made kind of these COVID-friendly presentations to identify signs of suicide and depression. That our PE department, since they hit all of the students, they rolled these out and they did a great job of rolling these out to students. And then we send messaging to teachers as to what to look for, parents what to look for, and we call these preventative measures. But of course, we always keep an ear to the ground for some of the more vulnerable students and families, with an eye out for those folks with pre-existing conditions, as we say, who might be more vulnerable to the social and psychological impact of the pandemic. So we work with teams to reach out to the families in the communities, see if they need anything. We flag those students if they're in remote learning, if they're not logging on for class, or if they're struggling to engage in learning, we reach out to them and may even pay them a visit. And we see if they need anything. Do they need internet, technology to get online, or we might coach families as to how to set up a workspace and structured environment to get as much normalcy and structure in the family for the student. Or we might hook families up with community resources like mental health facilities, food banks, childcare, and the like, stuff like that.
Thank you so much for those insights. Jordan, our next question is for you. What are some things that you have found helpful during the past year to maintain your mental wellness?
Yeah, sure. So I found out during the past year that just doing nice things for myself or giving myself mental health days just to relax have been super beneficial in maintaining my mental wellness. And not only that, but making plans with my family as well, that helped so much. And during quarantine, I found myself planning lots of movie nights and backyard picnics or glamping sometimes with my family. And I also did lots of mani-pedis and face masks, and that helped a lot as well. Just small things that could keep me productive helped a lot with my mental health. And now that school is in session and I'm going back every day of the week now, I find that still trying to incorporate some of that me time and family time is super important in maintaining a nice, healthy balance for my mental health.
Great, thank you so much. Gavin, how can schools and other adults best support teens during and after COVID-19?
Just from my perspective, at least what was helpful for me with like my family specifically is like my parents, inviting my sister and I to conversations about how we feel, or like how current events like, the pandemic has, made us feel, and like these disappointments that we've faced throughout the year. I think inviting us into those conversations, which sometimes can be hard to, reach out to like my parents to want to say, hey, this is how I feel to them, but maybe them inviting me to that conversation. And also them, what was helpful for me at least was when, maybe they didn't try to just invalidate how I was feeling right away. Or like, they didn't try to fix it immediately. They kind of accepted that this is like my own truth at the moment. And it's okay, like a normal response to feel that way. And it just kind of made me feel heard, which is something that was, hard for me. I know a lot of people too during this past year. With schools, I think, my school specifically, they just had a great, really important and informative presentation during Suicide Awareness Week. I think just increasing, even just more general programming throughout like just the course of the year about maybe like emotional regulation and intelligence, I think could be helpful for students, just because, it's that information's really pertinent and important. And throughout the course of the year, it's easy to kind of forget that, especially when you have, difficult times, things get harder. It's sometimes like more important to have those reminders in place. And that was helpful for me. I know for a lot of my friends too. So I think increasing that general awareness throughout the school year rather than concentrated in like just 1 month or a short amount of time could be helpful too.
Yes, I completely agree. Our next question is for Dr. Money. Dr. Money, are there any resources that are needed to better help schools support their students and increase a culture of mental wellness?
That's a good question, because when this all began, we were all scrambling to look for resources. Well, it turns out we resources were here. We just kind of had to sort of shift our focus and use them effectively. But I think professionals in the education field in general, not just the social workers, the psychologists and, counselors and like the mental health professionals, the teachers, administrators, teaching assistants, most of us were compassionate, caring people who are like in tune with students and who we see the value of fostering that sort of mental wellness in all students, and that social emotional learning or SEL, which many of us are familiar with by now, is really paramount in fostering that mental wellness. That's how we kind of develop the student strengths and resilience, which Jordan was just talking very nicely about, which how she took a positive spin, and she threw a little mindfulness in there too. I noticed. Awesome. In our school, and of course in many others, we try to embed that SEL in every nook and cranny of the learning environment, like in the way teachers teach, by putting SEL into the curriculum, in our discipline procedures. So like I said, these procedures, they're already kind of in place. We just had to change the delivery system a little because of COVID. But of course, there are instances where students need more help than the school can provide, where, in other words, where the prevention work, it's just not enough. In this case, we have professionals who are skilled at identifying a student in need of more help. And then we take action to find the right kind of fit to get them help in the community. So really, community partnerships are essential to the work that we do. And right now, our collaborative efforts with the community agencies and places that help out, they've really never been more important. So I think between the school and community, we have adequate resources. The trick is to maintain that effective, well-running system of professionals so we can really spot those teens and families who might be having trouble and to get them the help they need as soon as possible. To put it another way, it's really less about needing more resources and more about being on our A game to use what we have effectively and efficiently. And it's been a really exciting time to be a social worker, I'll tell you that much, because it really keeps us hopping.
Thank you, Dr. Money. Let's now hear from Mr. Matt Quinn with Rosecrans Behavioral Health. Rosecrans is a leading provider of behavioral health services with nationally recognized addiction treatment programs. Mr. Quinn, researchers have found that about half of individuals who experience a mental health disorder during their lives will also experience a co-occurring substance use issue and vice versa. Can you speak any more to this statement and what you are seeing as the most common substance use issues among teens right now?
Thanks, Justine. I'd be happy to answer that. And thanks for having me on this panel. This is a really cool event. I'm used to doing presentations where it's just me talking at a screen, so it's nice to be part of a panel event. So to answer that question, what I thought might be helpful was to pull up, instead of start talking about statistics, I thought it might be helpful to have some of that background. So what I was going to do is pull up, if I could find it here, just an article from the National Institute of Health, and hopefully that's showing up. Is it showing up? Can somebody just mention that you're seeing okay. So this is from the National Institute of Health, and I really think it helps to kind of guide the answer to that question in terms of co-occurrence and what sometimes described as comorbidity. Because as you would imagine, and most people know, there can be a large overlap, whether it's teens, whether it's adults, there can be a lot of overlap with substance use and mental health disorders. And in terms of how many people are affected by this, you could see that we're talking about millions of people. And I think something to acknowledge with this is that, let me put this in the center here. I think a lot of this is highly underreported. So when we talk about these numbers, these are people that have been diagnosed and reported. So you're probably looking at double that 7.7 million in terms of having both a mental health and substance use issue, and even the number of people that have co-occurring. 20 million people with a diagnosed substance use disorder. I'm sure it's much higher than that when you include undiagnosed and mental illness as well. 42.1 million, probably much underreported. So I think it's important to acknowledge that. But one thing I wanted to point out with this statistic that I found was interesting is that the chances of somebody, you could see by the 37.9%, if somebody has a substance use disorder, and anybody that is in the work as a certified alcohol and drug counselor like I am, we all know in this field that if somebody has a substance use disorder, particularly one that is more moderate or severe, which is a Rosecrance specialty area is treating those, there's a very good chance that there is an underlying mental health condition that the person is trying to, the term is to self-medicate, especially at those higher levels. Because, and I think this idea of self-medication can help with the stigma around addiction and substance use that still persists to this day, is that what we've all learned in this field is that when somebody has a more progressed issue, the question is always, what's the pain? Where's the hurt? Because when somebody has this issue, really what most instances, what they're trying to do is they're trying to find a solution for, or a relief for the pain that they're experiencing. Now, with mental health, it's less frequent that somebody with a depressive diagnosis, anxiety disorder, are going to seek out substances. And I know this can be confusing. I try to figure out the chicken and the egg way to word this. Where is it going to be confusing? In other words, if somebody has a progressed substance use issue, there's a very good chance there's an underlying mental health condition. But if somebody has a mental health condition, then it doesn't necessarily mean, you can see by 18.2% that they're going to seek out a substance. I know that could be as clear as mud, but I tried to put that in a way that made some level of sense. And you could see I want to scroll down here and show you something in terms of, so this is barriers to treatment for mental health, and the second bars are barriers for substance use. And look at the first one, not ready to stop using. And what I always tell people is when people aren't ready to stop using, it's not because, and I tell this with the parents all the time, when they think their kid is just using to get back at them or to get in trouble or out of spite, that when these issues progress, it's really important to look at the why. Because if it gets to the point where someone needs treatment, needs therapy, there's almost always going to be a why. And you could see that they're not ready. They're using the substance as a way to cope. And so we have to, in this work, we have to build an empathy and understanding that this isn't about a moral issue or trying to fight. It's about how do we provide support around the depressive diagnosis, the anxiety, the ADHD, the trauma that are going to support this, that are going to kind of be some of the more healthy cures to this, versus looking at it as kind of a confrontational model. And you can see here in terms of barriers to receiving substance use treatment, 13.1% might cause neighbors to have a negative opinion. 13.0 might have a negative effect on job. That's where that stigma is in place. So it's very, and then you could see not knowing where to get treatment, no health insurance. So aside from improving the stigma and empathy around this, we really need to do a better job of providing more availability for these services, and also help to make people aware of where these services are. And that's with Rosecrance, that's a big part of my role. That's how I know Jeff and Joe is through is through the work I do, because the access is one thing, but then letting people know where these services are that's really important. So I wanted to emphasize those points through some of these statistics in terms of the need to break down stigma and provide access and let people know where these services are. There's still a lot of work to be done. I mean, just look at this pie chart in terms of who gets treatment. 52.3%, 0.5% get none. 34.5 get, well, you could see the numbers. Look who are getting substance use treatment. 3.9%, and getting both 9.1. So that speaks to the stigma. It speaks to the availability with insurance and other funding challenges. It speaks to people knowing where to go. People might have this issue and they don't know. I get this all the time. Thank God I got your number and I could talk to you. I didn't know where to go. So I think those are, if we could identify areas of improvement, those would really be the biggest ones that we need to improve upon. In terms of the second part of that question, in terms of what we're seeing, it is largely still at this point, I call them the big three, and they've been it used to be the big two, it used to be the big three. Let me explain. So alcohol has always been number one. It still is, but the Illinois Youth Survey is saying that up until about early 2020, that vaping and nicotine products was catching up very quickly to alcohol use with teens. The fortunate thing that happened even before COVID, and it's funny because I think people have forgotten this because of COVID, but I don't know if people remember, but in the late fall and winter, 2019, 2020, there were young people that were ending up in droves in hospitals. Some were dying. Some were having severe pneumonia-like illness, and it was because of the chemicals in the vapes, the chemicals in the marijuana vapes. And the good news with the Illinois Youth Survey is that we're seeing that the numbers from 2018 to 2020, and the Illinois Youth Survey is done on even number of years, the number of kids vaping, whether it's nicotine or marijuana, went down. And I think when I first saw that, I thought, oh, COVID. But the surveys were done, and the numbers, unfortunately, of schools that participated were down because a lot of them didn't get to it before COVID hit. But it's very clear that the numbers of kids that were drinking were similar, and that always seems to hold pretty steady. But the number of kids that were vaping, and I'd love to hear the youth perspective on this, it went down. And I think the impact of hearing about these hospitalizations and these deaths really had an impact. Now, my curiosity, though, is what is the long-term impact? Are kids, because of COVID, are they going to forget about those news stories about kids ending up in hospitals, or are they going to remember that? Or is the acceptance of marijuana and the persistence of vaping going to get people to forget about that, where we see the numbers go back up? So I think we really have to be persistent around ongoing education, and not forget about alcohol, because I think with all the attention I've paid to educating on vaping and marijuana, it could be easy to forget that alcohol still is number one in terms of that entry typically with young people into substance use. So hopefully that starts to answer that question.
Thank you for that, Mr. Quinn. And Mr. Quinn, our next question is, data collected for DuPage County pre-COVID indicated that over 30% of high school teens experienced a depressive episode within the past 12 months. Do you see that number being impacted due to COVID-19?
Very clearly, and I'm sure that the three of you could speak to that just from what you've seen from your friends. The bottom line for me with that is disconnection. The term I always use is disconnection. I mean, there's a growing body of research that as humans, that we are built to connect with people to optimize our mental health, right? And so when you're disconnected from friends, I'm calling it the 1-2. I've been calling it the 1-2 punch. It's a disconnection from friends. And I think it's important to recognize with that disconnection from friends that it's, you could talk to somebody on the phone, you could snap them, you could text them, you could see them on a screen. But we all know, and the science backs up, that's not the same as hanging out with your friends at the park, hanging out at a dance. In person, there's just something that's more satisfying to that part of the brain that needs that versus a screen. So that's been missing for the most part for a year. And then you have the disconnection from how Dr. Money put it very, very eloquently, that the Maslow hierarchy of needs, that the things that teens rely upon to feel the kind of the connection and self-satisfaction of proms and the accomplishment of sports or National Honor Society or academic accomplishments. I mean, those can still happen, but they've been just severely cut back by COVID, where I think it's just harder for kids to feel either the social or accomplishment satisfaction that comes with those things, because the availability to achieve those things, not necessarily fail at them, but even to have the opportunity to achieve them and feel good about that, has been cut down so drastically that I feel like that when that's not there, not only is it heightened anxiety, but it's, gosh, I don't know how to validate myself. So that's naturally going to lend to higher feelings of depression, if that makes sense.
Thank you for that. This has been such a great discussion with such interesting insight. Our youth group Reality is always looking for ways to address issues and make change in our communities. Changing policy is something that our group really puts an emphasis on in order to achieve maximum sustainable impact in the community. We are so lucky to have an elected official on our panel to explore some policy level change related to mental health. Representative Tara Costa Howard, the last couple of questions before we open it up to viewers are for you. There is currently a bill that would allow students to take mental health days from schools, just like they would use a sick day. Do you have an update on where this bill stands? And can our teams do anything to help pass this bill?
Got it. Sorry. Well, thank you everybody for including me today. And yes, Justine, there is something that all of you can do. The bill that you're referring to is House Bill 576, and we also have it as Senate Bill 1577. House Bill 576 that was introduced by Representative Lindsay LaPointe, passed the House unanimously, and is now in the Senate, where it has been assigned to the Education Committee. And they're talking about that bill in the Senate and potentially going to, they want to expand it a little bit, right? Because the point of the bill is so that students have the opportunity to take a mental health day. Right? We know when we're sick in our body, whether it's a fever, we might have the flu, a cold, a stomach bug, we have the opportunity to have our parents call us in and take that day to let our bodies rest. Well, the reality is our minds need that rest as well. And our mental health is just as important as our physical well-being. And so House Bill 576 and Senate Bill 1577 do just that. They recognize the fact that our mental health is just as important. And that would allow students to take a mental health day from school. Like I said, it's the House bills in the Senate. The Senate bill came over to the House. I think we're going to work on the House bill in the Senate. And Senator Martwick is going to be working on that bill, as well as Senator Karina Villa from DuPage County.
Thank you so much. And our next question is, Representative, are there any other policies being reviewed that would increase mental wellness for teens?
Yes, we have a couple of others. We have Senate Bill 2014, which was introduced by Senator Cullerton, which would also require public higher education institutions in Illinois to publish the National Suicide Prevention Lifeline and Crisis Text Line for students. And that information would be on your student ID cards. We have this Representative Jenny Yang had a similar bill as well. We want students to get the help that they need. And so some of these are policy decisions that we're working on. I also want to bring up to all of you that here in DuPage County, and in particular that impacts our Glombards, is we passed in our community that Milton Township will now have a 708 mental health board. This is very, very important. It passed by just a small margin, but we don't care. It was a recognition by our community of how important mental health is in our community, shall we say. And so I would love to see our teens and this group get involved with that initiative. I think you all should be contacting our new Milton Township Supervisor, John Menino, and asking him to make sure that we have a student who is represented on that board, or somebody from our school system. Dr. Money, I'm going to volunteer you to make that call as well. But I think it's really important because it demonstrates the need and the recognition. I will say again, part of our Glenbard area is that Bloomingdale Township as well already has this board. So while Milton, which has covers Glenbard West, Glenbard South, and part of Glenbard East, and part of Glenbard North, I believe as well, and Bloomingdale Township, I think, has some of that too. Our community wants to make sure that our students and members of our villages have the services that they need. And I'm really hoping that you all get yourselves involved in that program as well.
Thank you, Representative Costa Howard. We have a lot of teens who are eager to get involved and address this topic. Now we are going to take some questions from the audience. So our first audience member who has a question is JB. JB, take it away.
One second. All righty. This is for any panelist to answer. What are some strengths that you see in our community as it relates to youth mental health?
Dr. Money, would you like to offer some insight into that?
You guys can't see it, but I have a cork board in my office that's absolutely full of clinics. And I don't know if Matt Quinn, if you know just the vast amount of therapists that we have, a very condensed amount of really, really good community therapists and clinics that kind of take care of the whole person, mental health, mental wellness. So I see that in our community, but also we were forced to take a look when COVID hit really closely at the other kind of more sort of fundamental grassroots social work types of resources like your food banks. We've got a vast amount of those that they all kind of work differently, but we've got quite a few of those. So we've got a lot of stuff in the communities. Like I said, it's just sort of that getting it out there and linking people with these areas that is really the challenge. But they're there. There's a lot of fruit out there on the tree, I guess is the best way to put it.
Yeah, and I'll add in, back to my point about availability and awareness. Because DuPage County is fairly densely populated, because I work with a lot of clients and families that live in very rural areas where their access to resources, it does not compare at all to what we have here in DuPage County in terms of outpatient therapists that specialize in everything from trauma to eating disorders to substance use, outpatient programs that are a step up, that are multiple days a week, that specialize in all these things as well, hospital-based programs. The issue, I think, and again, the thing that we need to work on better is the awareness of how do we make all of the families know that need this, that all these resources are out there, and certainly school social workers and other contact points play a role, but I think there's always room for improvement in terms of making that awareness higher, because I think right now the availability of these resources is high, but the awareness could use a little bit more of a boost.
I would agree with both of you, and I think really the key is the awareness and how to get that information out there to people with social media, with door knocking, anything that we could do to make people aware that these services do exist. And I would say that during COVID, one of the things that surprised it didn't really surprise me, I guess I will say. It made me happy to see our community come together to check on neighbors. When we knew that there were students out there, families who were struggling, if a neighbor knew, they picked up the phone and called, and they did their very best to kind of come together to make sure that somebody had the services or the extra help in any way, shape, or form that they needed to be able to get through. These were tough times. And we saw that even with the mental health component. Again, families reaching out to our schools, friends, peer to peer, recognizing that somebody might be struggling. And again, being able to reach out, pick up the phone, call somebody to try to help one another. And I really think people stepped up at this time.
Thank you so much for that. Our next question is from Fatima. Please let us know what your question is.
So since we've been seeing this this increase in suicide and mental health issues during COVID, if we are concerned about a friend, how should we best help them?
Let's get started with Gavin and Jordan. Jordan, do you want to start based on what your personal experience during the pandemic, how you've been able to help friends?
Yeah, I definitely think I've been able to help friends just by communicating. And I know communication was really hard during quarantine and when we weren't in person. But just that aspect of reaching out over the phone, asking the simple question, hey, how are you doing? Like, I'm here. I think that's super important. Just knowing that you have a friend that's an advocate or a resource. And I also think that helping your friends out with trying to find resources is an awesome thing. I know my school had counselors available during quarantine, and I helped a lot of friends out, like, hey, like, you should really reach out to your counselor and see how they can help. and just know that I'm always here as well. So definitely reaching out and being there was super important.
Gavin, what are your thoughts?
Yeah, kind of going off of that. I think being there to listen to friends and like Jordan said, like offering that opportunity to hear what they're feeling, and also like just for having like letting them know about the resources that are available either through the school, like this trusted adults of the school. I think have been really helpful. And I haven't personally, been in a situation like that. Helping a friend, get access to those opportunities or resources. But I think that's just something that's really important, is when you have those conversations with friends, also encouraging them to reach out for extra help. And I think a big point, especially with like suicide, it's important, like even if friends are kind of reluctant to, maybe taking that extra step for them if they're not able to, just to get help.
Yeah, a couple things I would add in. One is try to practice, what we would consider to be core counseling skills. First and foremost is validation and empathy, is listening to and just hearing through what they're going through, because there's so many people, not just teens, but adults like us that have gone through this disconnection where it's having a significant impact. So just hearing it out and empathizing and validating, some of you might be feeling the same way in a lot of ways while you're listening to them talk about their struggles. Validate that and relate to that and empathize with that. That's core. That's probably the most valuable thing that you could do. The second thing I wanted to add in is don't be afraid if you're hearing about suicidality and you're talking about seriousness, plan, intent, specifics. Safety is way more important than worrying about them being mad at you afterward or those types of things. If you feel like you're hearing a seriousness, go to their parents. That's something that we're taught in this field, as if we feel like something is imminent, we are obligated to make sure that they're safe. And usually that means connecting with a parent or family member or somebody and really letting them know what's going on. I know there could be hesitance to do that, but I think it's really important to better safe than sorry is kind of the bottom line with that.
Thank you so much. Oh, Dr. Money, would you like to add anything?
Everyone was just spot on. Communication is absolutely key. And in terms of the skills, Matt hit that spot on. It's as if he saw the suicide presentation that Gavin did when we presented it in the district. That's one of the things we really focus on, is approaching them with empathy, without judgment, and not holding on to it. The number one thing I get when kids come to my office and say, hey, I got a friend who might be thinking of hurting themselves, but I don't want them to know that I came to you. And I always say, well, if we don't move on this right now, you might not have that friend. So this is something that requires immediacy. And in the long, I've never had a situation, and I can honestly say this, where it was as bad as we thought it was. And by the time the person got some help, got some treatment, when they came out the other side, I've never had anyone resent that someone went and told them. In fact, they feel held, they feel what we call contained, and they felt a lot better about their place in the world. So it's that was just, I thought, spot on what everyone said.
Thank you so much for all of those wonderful pieces of advice about what to do in situations like that. Our next question from an audience member is Emma. Emma, feel free to unmute.
So my question is, so my school, we have a student support alliance, but a lot of the walls we're reaching is how to, reach out to those kids who aren't ready to ask for help. So how would you suggest we kind of urge them to, ask for the help if they need it?
I think that's a cultural component. I think the more kids that kind of pull the stigma out of asking for help and sort of create what we'd call a permissiveness for it, it catches fire. I think the more people's ear are to the ground about where to get help, how to get help, who needs help, I think that it will spread and they'll feel more comfortable about it. And of course, having everybody know where to get help. So if they might have a little crack in the mortar and they're like, okay, maybe I do need to go get some help, so they can immediately go to a target person. And then also having a friend who's ready. That's what I mean by sort of expanding that network, so to speak. Having a friend who's ready to receive the information and then coax them in to getting help from an adult. So you just sort of keep at it.
Mr. Quinn, what are some of your thoughts on this?
Yeah, what I would add in, I was hesitant to speak up because it's kind of reiterating a previous point. But I think if some people can have misconceptions about what help is. They think that, well, no, that help is an immediate solution. And oftentimes they think to themselves, well, I've thought about all the solutions and I can't think of any. But if they realize that help, at least initially and early on, is about that empathy and that connection and that validation and the satisfaction that they feel in feeling heard and understood and not alone. If they realize, wait a minute, that's part of help, that they like that. And they're more willing to seek that out if they realize that that's half or more of the help is just that connection and that validation. So I think that's such a great entry point to get people open-minded about pursuing that even further and maybe looking at solutions or other perspectives or other things like that.
Would any of our other panelists like to chime in and share their thoughts?
I don't want to repeat. So I mean, what Dr. Money and Mr. Quinn had to say is exactly what we want students to do. We want you to feel comfortable reaching out. We want to do whatever we can to provide those resources for you.
All right, thank you so much for those wonderful insights. And then we have another question, again from JB. So JB, feel free to unmute and ask your question.
All right. This question is for Matt Quinn. If you think you are struggling with a mental health issue yourself, like depression or anxiety, what is the first step you should take?
I think it's always going to be who's going to be the bridge that can be the one that can hold your hand to access those resources. You know, I think of school social workers, you know, who are in that situation would be more than happy. That's what you guys are. That's what they're there for, is to be the one, to be that link to all of those resources. It can be a parent, certainly. You know, I think usually the best situations is where there's a team approach, where it's a collaboration with a school social worker and it's a parent that's gotten involved. Maybe it's a sibling, maybe it's a pastor at a church, where all of a sudden you have this network of support that can put their heads together and say, well, I know about this program. Oh, have you thought about this program through the church? Have you thought about this program through the school? Have you thought about this therapist out in the community? So it's really, who are the bridges? And those are just a few examples, some of the more common examples that we see. But it's all about who are the trusted adults that can hold your hand and kind of walk you across that bridge.
And Dr. Money, we know you work in this field as well. So do you want to just add a little bit to that question?
Sure. I think we work really hard as social workers to, when we're in the school environment, to be approachable. We go into classes, we talk, and my own personal style is I try to be as goofy and awkward as any freshman, so they can. So they feel like they can approach me a little bit better, and then sort of holding their hand and bridging that gap would be the next step. But first, they need to be able to approach you. And I might add too, and this might sort of feather in with the previous question. A lot of times, obviously, we can't reach all the students, but there's a great many compassionate teachers and other staff. Sometimes they'll come to us and they'll they'll sort of spot some red flags in a student and say, hey, this student is struggling, but they're not ready to get help. So we kind of coach them and encourage them as to how to maintain that relationship and look for to strike when the iron is hot. Says, hey, they're probably going to come to you and ask you for help. And oftentimes they sort of bridge the gap between us, and then we'll take the football and we'll run it somewhere in the community and get them even more help.
Thank you so much for that. And our final question from an audience member specifically is from Teresa. Teresa, feel free to ask your question.
Hi, sorry. So as we all know, it's been a rough year for families and many have had a hard time financially. And many of us students are used to the camaraderie of school life, but have since had to adjust to remote learning. How can families work together in order to support each other mentally, emotionally, and physically?
Mr. Quinn or Dr. Money, would either of you like to answer that question?
You know, I think that it's a good thought-provoking question. Obviously, you could tell by the silence, right? You know, I think it comes down to, you know, everybody in the family. I think it's important that there be a vulnerability model within the family, because I feel like if the parents portray this image of we're fine, we're good, then I think getting these services and kind of presenting for services at United Front, it's going to be harder, and I think students are going to be a lot less willing to reach out for help. So that would be the best answer I can come up with, is for parents, for students, everybody to, through this, realize this has been hard for all of us. So let's allow ourselves to be vulnerable together so that we can then access the services that we need to access, and not think that adults are fine through this. It's teens or children that have struggled, because that's where people are willing to ask for help if they feel like the people right around them are struggling as well.
Thank you so much for that. And then to end things off today, our final question is actually coming from our representative, Costa Howard, on our panel, and she has a question for our teens.
I want to know what what students want us to do, meaning what are the ways that we can help you as adults to get you the services that you need, or to be able to have these open discussions, whether that's policy in the legislature or services that are being provided within our community. What else can we do to help all of you?
Gavin, can we start with you before going to Jordan?
Yeah, so I kind of talked about this earlier, but at least, you know, one thing, maybe just, you know, opening and continuing programming for like the whole student body, you know, throughout the course of the year. At least like, and for me, it was really easy to, you know, listen to that information, and then like a couple weeks later, you know, I don't really remember it, or, you know, I'm so focused and caught up in, you know, difficult emotions or how I'm feeling, and then, you know, I kind of forget about that information. So I think just, you know, a continued, you know, reminder to students, and opportunities for, you know, that to be reiterated to the student body.
Yes, I totally agree with that. I just think making sure to keep mental health a priority in schools is super important, because it is an aspect that a lot of teens struggle with. And I think also having a sense of community for students that do struggle with mental problems and struggles during the school day is super important. You know, like having ethnic groups at school, just having that sense of community where kids can go, where they relate to each other and can help to nurture each other and give each other advice on where to go and where to get resources and where to find advocates is super important. So just making sure to keep it a priority is key.
Thank you for all those wonderful answers. And that concludes our panel today. Thank you to all of our panelists for participating and providing very valuable insight. And thank you to everyone who took the time to attend today. Now, before we go, if you or someone you know is struggling with a mental health issue, there are many resources available that can help, as you can see on the screen, such as the crisis text line. Anyone can be connected to a trained professional who can help them through a crisis by texting the word REACH to 741-741. This is a free and anonymous service that is available 24/7. You can find more information about this service at www.dupageplt.org/CTL. Additionally, if you'd like more information on Reality or are interested in joining our group, you can visit dupageplt.org/reality. We are always welcoming new members. Thank you again for taking the time to attend, and stay healthy. Bye, everyone.